Hello everyone, welcome back to my channel. So today we'll be discussing about xerostomia, but before that I will request you to subscribe to my channel if you're new. So let's start with xerostomia. Xerostomia is a clinical condition which is characterized by excessive dryness in a person's mouth. So if a person is suffering from xerostomia, there will be excessive dryness in that person's mouth. Okay, another thing is that there will be a number of lines which can be seen on the tongue surface of the person. You will find that the tongue appears to be fissured. I will show you in the figure that what a fissured tongue looks like. But in a very layman language, you can understand that there are a number of lines which can be seen on the surface. Now this is what the tongue looks like. You see there are so many lines and increments all over the surface of the tongue, and this is how a tongue looks like. A tongue which is suffering from xerostomia is looking like this. Now the question arises, what is the cause of xerostomia? Like, is it a very simple disorder? Actually, it's not a disorder, it's a condition. Is it a condition which can be seen in every other person, or there's any specific cause for this? So we'll be looking to first some temporary causes, and then we'll be proceeding towards some permanent causes. You know, the temporary causes, they are the reversible causes. Like if you treat the patient properly, these conditions can be reversed back to a normal tongue. So the very first thing we have is the psychological reason. So the psychological reason we have is, you know, when we are in the exam hall, we feel so stressed, so anxiety level is so high, there's so much depression we are facing, and that leads to xerostomia. There is excessive dryness of the mouth. हमें बार बार ऐसा मन करता है कि हम बहुत ज़्यादा पानी पीते रहे. So that is a psychological reason which is there for the xerostomia. The next condition which we have is the sialoadenitis. So what happens in this sialoadenitis is that there is inflammation of the salivary gland, and due to this inflammation the saliva production in the mouth is decreased, which leads to the dryness of the mouth. Another condition which we have is duct calculi. Now what happens in the duct calculi is there is blockage of the salivary ducts. You know, there are salivary ducts in the salivary glands, and now because there is blockage in this salivary duct, there will be obstruction in the salivary duct, which will lead to xerostomia because the saliva production will be decreased in this case. Another thing we have is drug therapy. Now there are certain drugs like some anticholinergic drugs or some antihistamine drugs which are responsible for the xerostomia. Now we come to the permanent reasons. If we talk about the permanent reasons of xerostomia, firstly, they can never be reversed back to the normal. The patient will be suffering from this problem for the rest of his life. So the very first reason we have is the salivary gland aplasia. What happens in this salivary gland aplasia is there is congenital absence of one or more salivary glands. So it means that from the very first day the child is born, there is absence of one or more salivary gland in the baby, which leads to salivary gland aplasia, and of course there will be low production of saliva in such child, so it can lead to a xerostomia condition. Another reason, many patients who suffer from cancer go under some treatments like radiotherapy or chemotherapy, so xerostomia can be easily seen in these patients also. Another thing which we come to is the clinical features. If we talk about the clinical features, so these are basically the features which will help you to diagnose a patient with xerostomia. So the first thing you will be seeing is that the patient is having dryness which is continued from a really long period of time. The patient can complain that there is dryness of his mouth, excessive dryness of his mouth from a very long time. There will be pain and swelling in the mouth. Of course, the patient is going to have a history of anxiety, stress and depression in majority of cases. There will be soreness in the mouth with burning sensation, which will make it very difficult for the patient to swallow anything or eat anything. Also, a very characteristic feature is the presence of rampant caries. The rampant caries will be seen. Now, what are rampant caries? You know, these kind of caries where only the root stumps are left and all other maxillary anterior, posterior, mandibular anterior, posterior are destroyed. These are known as rampant caries. Now we come to the treatment of xerostomia. Now if we talk about the treatment, then there are some systemic treatments we can do. We can ask the patient to chew some sugar-free chewing gums. These chewing gums will increase the activity of the salivary gland, which will increase the production of saliva in the patient. Also, the etiological reasons, all the temporary and permanent reasons which are there in the patient should be removed. There should be a lot of water intake by the patient, and also the patient should be suggested to maintain good oral hygiene. You should suggest your patient that he should brush properly twice a day, and he should take care of his oral hygiene. If you like my video and if it was helpful to you, do subscribe to my channel, hit the like button and share it with your friends. Thank you.